We have this idea in this country that when it comes to healthcare, more is better. You can't be too thin or too rich, and you can't get enough healthcare.
We all come to a similar conclusion that about 30% of U.S. healthcare spending is devoted to unnecessary services. And that's, $800 billion a year.
You don't have a significant blockage.
One person's waste is nearly always another person's income. And income turns into strong political defenses.
Why does American medicine cost so much? And if we're going to pay so much for it, why don't we get better results? A film coming up on PBS next Tuesday night, the 25th, takes that question on directly. It's produced and directed by Roger Weisberg. Roger, welcome to the Online News Hour.
Thank you.
Well, you showed us, instead of just telling us, a lot of the cost drivers in Money in Medicine. What are the main culprits for making American medicine so expensive?
Well, I think there are a lot of drivers. There's the aging of our population, there's technologic innovation and explosion. But I think the biggest single driver is our fee-for-service system that rewards volume instead of value and quantity of medical services instead of quality. And as a result, we end up doing a lot of things that cause more harm than benefit for patients.
But if we said to people, hey, I can do less or I can do more. If they're sick or someone they love is sick, hey, I can do these extra things that might work or I can do nothing. Isn't it human nature that they'll choose more?
I think there's a pervasive view that more is better among consumers and among a lot of healthcare providers as well. But what we're beginning to learn is you reach a point where excessive diagnosis and treatment reaches the point where you're doing more harm than benefit in a lot of cases. And as we look at medical evidence, comparative effectiveness, and outcomes research, we're discovering that often places that do less have better health outcomes for their patients.
When we compare UCLA and Intermountain in terms of use of care, what we saw is that similar patients in Los Angeles were spending 60% more time in the hospital. They were having 75% more frequent office visits. And of course, if you're seeing more specialists, by golly, you're going to get a lot more diagnostic tests and minor procedures. That led to the question of, were they getting much better health outcomes as a consequence of all this extra time in the hospital and all the additional procedures? And we found that they were not. UCLA is a very high-quality hospital, and I'd want to be taken care of there if I had an acute catastrophe. But they also provide a lot of care that I believe is unnecessary.
We get tremendous amount of access into patients' decision-making and doctors' counsel during tough times in a family's life. And I think one of the most striking passages in the film has to do with the mother and son. She's been in the hospital for months. She's unconscious, she's unresponsive, and yet the son doesn't want to give up on her getting better and doesn't want the hospital to stop treating her, no matter what the cost.
That's absolutely right. It's kind of a tragic situation where this woman who's completely incapacitated and has absolutely no chance for recovery doesn't have the opportunity to tell her healthcare providers or her loved ones what kind of treatment she would want. And so often what happens is family members caught in that situation feel a tremendous amount of responsibility, feel guilt, and insist that doctors do everything.
You know, miracles happen if you believe in miracles.
We do run out of miracles, and there is a time for everyone.
I don't know what that time frame would be that I feel or some family member feels, she's really not here with us now. I suppose something like that, something spiritual.
This is not something that I would want. It would be torturing me. On the other hand, other people feel very differently.
You do everything you can to preserve life. That's what my mother would want.
This woman languished in the ICU or in a very intensive hospital bed for over 10 months. The son estimated the cost to Medicare and therefore to us as taxpayers to exceed $5 million since this incident started.
Healthcare is one of the things, of all the things we buy in our lives, where most people are not paying the full cost. So when they make these decisions, they're making them kind of in a vacuum as far as cost and benefit because they're not paying the bill.
There's no doubt that patients are insulated from the costs and consequences of the medical decisions they make. And yet we know from research that when patients are really given a true fair choice, that is, they're given all the information about the costs, benefits, risks, trade-offs of elective procedures, they tend to choose about 30 to 40% less treatment, and their rate of consumption drops to about the level that doctors choose when they're confronted with those same medical problems.
Well, talking about truly informed choices, one of your experts mentioned that between drug interactions, medical mistakes, and hospital-acquired infections, getting medical treatment is one of the the highest-rated causes of death in the United States.
Yeah, all of those situations combined account for the third leading cause of death. I mean, that is a shocking number for patients, and I think more than anything else, that statistic ought to convince us to abandon the pervasive view that more is always better in healthcare.
Roger Weisberg is the producer and director of Money and Medicine. He joined us from New York. Good to talk to you.
Great talking to you. Thanks so much.